Community Voice. I'm Fara Sax. I have the pleasure joining me today, members from the Dade County Medical Association, Dr. Rafael Fernandez and Angel Bosch. He is the president of the association, and managing director. Angel, thank you so much for joining me today on the Community Voice.
Thank you for inviting us.
Thank you for having us, please. Thank you.
So tell me a little bit about Dade County Medical Association. I mean, you are a doctor, a surgeon outside having your own practice in Coral Gables. And why did you get involved with the Dade County Medical Association?
Well, I got involved in a process to try to give back to the community and give back to the community of physicians so that we can in turn give to the community of patients. It allows us to help physicians practice medicine. The practice of medicine gets more complex every day, and we can then help provide assistance to the physicians both on an educational level as well as on a health level, and then they in turn can provide health care to the patients who also need it.
Did you grow up in Miami?
I did not. I was actually born in Boston. I grew up in Chicago. I trained my residency in Kansas, but I had an uncle here in Miami, and in Fort Lauderdale, and my wife had an uncle in Miami. So we thought, hey, we used to visit them in the summers. Why don't we go down there and live? And that's how we got here.
So between Chicago and Boston and the weather in Miami,
it wasn't a tough choice.
No, I don't think so. Well, we're better for it. Thank you for being in our community, helping people get better and well and return to their activity on a daily basis.
My pleasure.
Angel, how did you get involved with the Dade County Medical Association?
Well, I was doing very good in Puerto Rico, but Hurricane Maria went through the island. It was a very tough hurricane, 155 mile per hour hurricane, category 5. And then after the hurricane, I have to say this, I spent more than 5 months without power. During that time, I received a call from my boss, that is Fraser Cobb, and he said, hey, there is an opportunity here in Miami. Let's talk. And that's how I got here. So I came in May the 30th of 2018 and start working at June 4th. So I don't even have time to move from my house. So I have my house from Puerto Rico, and I haven't moved 100% yet.
So you didn't come for the weather because you went from hurricanes.
No, I came from paradise
to paradise
to the sunny state. That's a difference.
So tell me a little bit more about DCMA. How does that affect patients? How does that affect doctors?
So the Dade County Medical Association is the local organization which represented at the state level through the Florida Medical Association and nationally as the AMA. And I don't know if it was correctly attributed to Tip O'Neill many years ago that politics is local. And so the local community are the physicians from the county that hopefully all become members and therefore can provide for us an organizational structure to help overcome some of the challenges that we as physicians face, both in the delivery of healthcare as well as for our own health.
So what kind of difficulties have you seen and experienced as a doctor yourself? I mean, personally, and how has the organization, the association helped you?
So one of the topics that's hot currently is pre-authorization. And
oh, really? You think?
Slightly, isn't it? Hot on the press these days.
So talk about what that means.
So there are certain steps that are required before a service is provided. So you will, as a patient, come to see a doctor, get examined, go through the workup, and the doctor may recommend a test. I'm an orthopedic surgeon, so let's say an MRI. Well, I'll give you that prescription, but then that has to go through a process of the insurance carrier to look through various points and authorize that service. Sometimes that takes a long time. It requires and puts a huge burden on the physician's office. You need a person to basically start calling, a long time on the phone, going through a bunch of details. Patients may need to do that, and then you have to do a peer-to-peer. And so that sometimes can be very burdensome, not only and frustrating, both for the physician and for the patient. So now it's a hot topic. It's in the legislature. We're hoping for their assistance to try to streamline that. Doesn't mean that things shouldn't be looked at. Sometimes either you want to obviously avoid abuse, and you obviously want to be efficient in your care delivery, and you want to be cost effective, but you want to make sure that it's not a barrier. And so that's one very hot topic at this point.
Another hot topic, Dr. Fernandez.
Oh, I love all this hot topic stuff. I love it. It's just between us, right?
Our little secret that we're going to let out to the community.
The other thing is the expansion of scope of practice. I think that we should bring this up to this conversation because that's affecting the quality of service patients are receiving.
Right. Scope of practice is also another hot topic. Again, it's important for the community to understand who they're getting their health care from. This is not to disparage ancillary providers. They're intelligent, very motivated people. They're there to help us provide care to a growing community. As we know, Florida is growing by leaps and bounds. And so it's important, and I think that the Academy of Family Physicians actually put out a program which was very interesting. It says, what does it take to be a doctor? So to be a physician, it takes going to college for 4 years, going to medical school for 4 years, passing multiple tests, becoming board certified in the medicine part of med school, which was a 3-part exam, and then picking a specialty and spending somewhere between 3 and sometimes up to 7 and sometimes 9 years of training. And then passing your boards in that sense. The ancillary providers don't have that degree of training. So it's important that they're out there to help us, but independent practice, I think, is something that is controversial, to say the least, in our community.
So what you're saying, there's no hamper, there is no catch. Is that what you're saying, that sometimes that the patients these doctors do not have that accreditation, or that they're, I explain that a little bit more.
So the level of education is the first step.
Absolutely.
What does it take to get to becoming a physician? Mm-hmm. And as education has grown, 20 years ago, the term doctor meant physician. Today, there's a doctorate in physical therapy. There's a doctorate in nursing. There's a doctorate in occupational therapy. So these individuals are actually advancing in their training, and they, by definition, if they have a PhD, are doctors. And then that term needs to be clear, though, that although I am a doctor, a medical doctor, I'm a physician, they're not. They have an important role. And so that distinction, I think, is something that the community hasn't been educated on.
So how does one get educated? Let's say I'm a layman, which I am. I'm not a doctor, nor do I play one on TV. But how do we as consumers, because we are consumers, patients, know where our doctor and what kind of accreditations they have, and how can we safeguard our own health? What's available to us?
I think that the first thing is that you have to ask. Because not necessarily somebody with a white jacket and a stethoscope is a physician.
What could they be then?
It could be a nurse doctor. It could be a PA. It could be a advanced practice registered nurse. It could be a lot of people that are not physicians, and I mean MDs or DOs. Okay, so you have to ask. That's when you're there. Before you go to your appointment, you can see the credentials of those guys in the internet. You say, let me see the specialty.
Do you think that us as patients, as uneducated when it comes to knowing accreditations and what our doctors should have to perform procedures, do you think we have enough education, and how can we get more education if that's not the case?
I don't think that we have, and that's why we're trying to put together something, a campaign to get that education out.
So this is for people like me.
Correct.
And for our audience.
But
this is what the DCMA is doing.
That should.
The DCMA is contributing to that.
Mm-hmm.
We're trying to collaborate with, in this case, the Family Physician Organization.
And the FMA.
And the FMA. And so when you said, how can the public get educated? Well, services like this, I mean, meeting with you, getting the message out to the community so that the community can see this and understand what this is. The program on the website for the family medicine organization kind of does a more point-by-point delineation of the training.
Do you have that? Do you have that website just in case people?
We can definitely get that for you, absolutely.
Okay, perfect.
So that's what you can do beforehand. When you go there, also, when you go to the doctor, most of us at the hospitals are required to wear badges. So it tells you, and I've got all sorts of little stickers from my granddaughter.
So who calls him?
Visiting.
Is this the one who calls you Coco?
This is the one that calls me Coco.
So he calls him Coco, and they have to go on a date, and they're going on a date, which I can't just tell you where they're going, but they're going to go for ice cream.
Yes, and we're going for chocolate ice cream.
Okay.
Specifically.
So just be aware, if you're in a ice cream store and you see Dr. Fernandez and his grandchild, just know it's going to be chocolate ice cream. Only.
For her.
It's a pleasure having grandkids, isn't it?
Absolutely.
They really bring things to like the reality of just being present.
Exactly. In fact, she asked me yesterday, she goes, do they call you Dr. Coco? I'm like, well, no, not really, but that's okay. You can.
So sweet.
Very sweet.
So they wear a lot of badges, and there's
So
a
we
lot of
wear
stickers
badges.
from his granddaughter. But
Exactly. So if I could get this off of here, it says physician, so that you're identified. It tells you what you are. It says,
says
your name
killing
and your
it.
title.
Though. It says killing it right now.
That's right.
It's kind of scary.
That's right. So, and ask. The person, when you're in the office, when you're in the hospital, the person coming in to treat you, to evaluate you, should always present themselves. I always try to come in and say, hi, I'm Dr. Fernandez. Obviously, if you're in my office, I'm a single practitioner, so if it's not Dr. Fernandez, it'll probably be a question, but I'm Dr. Fernandez. I am an orthopedic surgeon. I'm here to see you because of X. That way you know who I am and where I'm coming from. And if you're the nurse taking care of them, they're very good at doing that in the hospital also. Hi, I'm Mary, I'm your nurse, or I'm Joe, I'm your nurse. I'm here to do this and proceed with the process. And asking, if you have any questions, it's like, well, who are you? I mean, we're human. Sometimes we may forget, hey, I'm Dr. Fernandez. It's like, well, by the way, who are you? And okay, I've seen 6 doctors today. What kind of doctor are you?
Yes, and the thing is that you have to make the difference between doctor when they say, I'm Dr. Bosch, for instance. Are you a physician? Because you can be a doctor in nursing. You can be a doctor as a physician assistant. But are you a physician? Those are the two key questions that you have to. Are you a doctor? Yes. Are you a physician?
And that's hard to differentiate as a patient to know to ask these questions.
Right. And again, we've been culturally, and these doctorates in these other areas are kind of a new evolution, and it's probably just going to get more complex. There may be double doctorates and triple doctorates in various and specialties. So it's good for the patient to know. It's very important, I think.
Absolutely.
Who's doing what.
Absolutely. And as the president of the association, what is your role? I mean, you have a full-time other full plate, and now you've taken on more recently as president. So tell me what that entails for you, because you have a whole helping list of elves helping you along also with Angel and other doctors along on board as well.
Right. And we have Desiree who also helps, and Betty. So these are all...
Hi, Desiree. She's behind the camera today.
That's right.
She's always behind the scene.
And doing a great job. For example, one of the things that so I get to be the face of the DCMA for 12 months. They probably could have found a better looking guy, but what could I tell you? So we do multiple things. We do obviously community issues. We do educational issues. So we just happened to one of the things for physicians is required graduate medical education credits, and for licensure every 2 years when we renew our license. We need various, what are called CMEs. So through the DCMA and through FMA, but in this case it was DCMA, we put on a live hybrid educational component where we brought in speakers to cover the topics that we require those CMEs in. That was done both live as well as by streamed. It was an excellent outcome. We've had over 150 physicians online and in person. So that helps us because it kind of focuses everything in one place as opposed to going on the internet and trying to find the domestic violence CME credits here and
Human trafficking,
the human trafficking, the narcotics as another hot topic right now, and
medical errors.
exactly.
So really is a funnel. It really is a funnel to help doctors really be on target and on step with what's going on in the culture of their community.
Correct. And also to provide them the information of these hot topics that are going on and what are we doing and how can we take their opinion, their voice, and bring it to the state level as we go forward.
And how many members do you have in the association, Angel?
We have close to 1,000.
And who are you looking for? Who are you looking to bring into the association?
All licensed physicians, MDs and DOs from Dade County.
And how are you getting that word out? But this interview, obviously, but what else are you doing to help promote and get the word out?
We're in social media we're in the different platforms in social media. We also we
publish
use
a journal.
We used to have one papers. We're looking, and I have to say this: we're working with you with community news to spread out the word. So we look for different ways to spread out the word of the DCMA.
Absolutely. And what are some of the benefits for doctors to be affiliated with the organization, the association?
One of them that all the CMEs for the mandate credits are for free as part of your membership. Mm-hmm. So also we do advocacy that I know that Dr. Fernandez is going to speak about. So we can take all the issues all the hot topics to the state level. So we can deal with the guys in Tallahassee. So they can looking for solutions to make our life better here in Dade.
One of the things for recruitment, one of the things that the DCMA a couple of years back brought back to life was an educational research competition. So once a year, the residents and the students can present research that they're doing, and then we review them, we judge them, and then they have a competition, and then we actually provided prizes for first, second, and third place. And in fact, there was a young student last year who's not even in med school who came up with an incredible project about contamination things in the subway, culturing, pre and post COVID. So it was
16-year-olds.
16-year-old kid
Wow.
who did that.
Sometimes out of the mouth of babes comes some of the best ingenuity. Absolutely.
And he went through Bascom Palmer, and Bascom Palmer supported him, and then he submitted his
The
project.
research. That was great.
So some of the things you do is I was reading, it's promoting quality medical care since 1903.
Mm-hmm.
Wow. And the committees, you have a membership committee, you have a continuing medical education, which we talked about, political action, community
Correct.
outreach, and women in medicine. So you want to hit a little bit on that?
Sure. One of the things we want to encourage is more female participation. I think the last numbers are 50% of the med school classes are females, which is great. And we want them to participate in our organization and also at the state and national level. So one of our members who's the chair of that committee, has now created various social events to try to attract female physicians, MDs and DOs. It's also good to network and to meet each other and know what's going on and share ideas and, sometimes just vent. And get good ideas.
And not only social, we're also bringing female physicians to our leadership, because it's not a thing that we're going to bring females for have a drink or to mingle. No. We're bringing female physicians to our leadership, to our board, and as a matter of fact, in 2 years, the president of the DCMA is going to be a female physician.
All right. I love that.
And a couple of years back, we had a female physician president also. So we're definitely cutting edge on that. And the idea is not just social, I agree. The idea is for everyone to meet and then develop and foster putting people into the right channels to move up in the organization and eventually take the helm, as they have done in the past and will do so in the future.
That's wonderful. And I know this has been, we've talked about physician. And what about patient? Can patients or the audience that are not doctors get involved with your association? Is this something that's open to them to understand more and to learn more?
So they can't be members.
Right.
But what they can do is they can use our website to learn and be educated on the topics that are going on in the community at this time. And they can, without a doubt, call, and if they have a question, we can hopefully help them and guide them in the direction that they may need to go.
So
They call to our office. We receive a lot of calls, patients asking, is this a doctor in good standing? how can I can get my files from this for the doctor. So we receive a lot of calls, and we give some education to the patients so they can go the right way.
Absolutely, and I think it's an important resource for our community. So if you really have questions, it's miamimed.com or 305-324-8717
Yes.
to get more information. When we're getting back to physicians, what are some of the things that physicians face? I mean, we all expect like our doctors to be in tip-top shape, emotionally, physically, spiritually, to be on point for us. But there are times, and I'm sure during this pandemic, there's been a lag, a depression, a downer. I mean, the way medicine has been practiced now, there's telemedicine, which has really become in fruition, and we're not business as usual, and sometimes physicians do struggle.
Right. We are human. Sometimes we forget that.
And people forget that also.
That's what I'm saying. We just expect you to be, Dr. Fernandez, you're going to help me and you're going to be on point. But sometimes you don't feel well. So, not just so you, but,
Right.
Whoever's working with us. So what resources does the association have?
So the very good points that you brought up. COVID put a huge stressor on the system from top to bottom, both physical plant as well as on physicians. The issues of having to mask 24 hours a day, donning protective gears at the beginning was very much like, Ebola. You see that. But, and that put stress on everyone, both the patients and the physicians. That also, you always want to look at sometimes from crisis, always good things come. Telemedicine being one of them. I think that's an opportunity. Now, it's not going to be one size fits all. And not every specialty is going to benefit from telemedicine, but telemedicine is another thing which we can now reach out to rural communities to help provide basic screening or even in some specialties care for the patients. For us, as I said, we're human. And one of the things that DCMA did during the COVID pandemic, the people that were forgotten were the family members of the physicians. So we received a grant. And that grant was used to obtain personal protective equipment for the family members of the physicians. So we had kind of a drive-by where we went by and they gave us a little package, so a couple of masks. You said, how many members in your family? So we were able to get some masks, some lotion, and things like that. That was one thing that was actually very, very beneficial because one set of a society that got forgotten was the families of the physicians. And then that has created a stressor. Burnout as another hot topic that we hear in the media. And now the Physician Wellness Program has put out this program for us to help us in a time of need, both in a confidential fashion. So
this is called the Life Bridge Physician Wellness Program.
Kind of a mouthful, huh?
Yeah, I did it well. I read really
did.
well. And you providing confidential resource to those that might need help.
Correct.
And that number is 1-888-948-9555. Tell me a little bit about what happens for your physicians and how this has been a benefit.
So you call the number, someone's there to help you and guide you through it, and then you get some basic. I don't want it to be misrepresented as like complete care for the entire process, but it gets you into contact with a person, a healthcare provider, guided numbers to where you can proceed and keep working up your condition, and guide you along the right path so that we can.
To be more specific, this is a free benefit for our members. That's also another thing that we give out to our members. So you are part of the DCMA, you have this benefit, and you will receive 4 sessions with a counselor. It's total, and I want to make this point very clear, it's totally confidential. It's very different than in an employee assistance program. They don't have to report to anyone.
So there's no electronic medical record recording of it. Mm-hmm.
No, so you got a call.
888-948-9555.
A physician a counselor is going to answer that call. You're going to make an appointment. You can do it by in person or by internet. Okay, and then you have 4 sessions, and in 4 sessions, probably they will be referring you to another healthcare provider because maybe you need a long-term therapy. Maybe you can fix what you need in 4 sessions because probably you need to talk and take out of the system whatever you have inside. And in 4 sessions you can do that, and that's it. And that's and it's free for you for all members of the DCMA.
It's good to know. It's a very wonderful resource. I'm glad that you're doing this for your association members. How has it changed? Where are we now? What's going to happen next? I mean, we don't have a crystal ball, but where do you see medicine moving, and how does the association help that for doctors make those transitions that need to be made?
I think that medicine's moving. It's almost like the universe going in so many different directions.
100%.
And I think that navigating that is important, and the DCMA can provide that assistance, both on an educational component, where like we talked about before with the CMEs. Our journal also provides peer-reviewed articles that you can contribute to as well as read. And then also education to the community of hot topics that are in the legislature so that physicians can then act on that. Call your legislators. I mean, I had the opportunity through the DCMA to participate in Tallahassee last year and meet the legislators. They have a tough job. They're trying to legislate on such a wide spectrum of topics, and medicine being just one. We try to serve as educators to those legislators and say, listen, from a medical perspective, as a medical professional, here's my take on what's going on so that you get better understand and you can better legislate, which affects not only me and you, but the community at large.
Do they get it?
Some do. Most of them are pretty open to it, I have to say. The experience, it was a very pleasant experience when I was there. I mean, did the legislature vote, in my opinion, correctly on practice expansion? No, they did not. I think that was not the right way to go. Hopefully, by going there more often and reaching out to them and making yourself available to these people.
What is practice expansion? Explain that a little bit.
In other words, allowing, in this case, it was the PAs and the nurse practitioners to practice independently.
Independently from?
Normally, a physician assistant and a nurse practitioner, advanced nurse practitioner, works under the supervision of a physician. In this case, they would now practice independent without supervision. And that goes back to the educational component that we talked about before, the number of years, how many hours. I think there was a pretty popular book back that it takes 10,000 hours to become proficient at something. I forgot the name of the title of the book. I don't want to advertise for the book here either.
I love that, though. I guess we're still all a work in progress.
We are a work in progress. And in fact, the examples they gave were the Beatles. You know, everybody knows the Beatles, which I'm dating myself. I realize that.
I'm with you. Don't worry about dating myself. That's okay.
But everyone knows the Beatles when they became famous, but they don't remember all the bars and clubs and pubs that they played in 10,000 hours before they got to become the Beatles. And we see the end product. And that's what we see here. What's the end product of a physician? Well, it's thousands of hours of training. And if you're not, reaching those hours, then you're not really fully developed, to be practicing independently.
So what you were trying to do is to see if the nurse practitioners can operate. What were you legislating for? So they can operate.
Well, they passed legislation which allowed them to practice independently, which I think was definitely controversial, and I think that they're probably not the way it should have been, not independently. I think that they do require some degree of supervision.
Another pair of eyes looking
Correct.
in.
The expansion applies to advanced practice registered nurse specifically, not necessarily all nurse practitioners, but the advanced practice registered nurse.
That's why I like Angel. He just he makes sure that I'm giving the right delivery and saying the right thing because I don't know. Who knew, right?
Right.
So I appreciate that. Thank you.
Yeah.
So what message would you like to send out to the community about the Dade County Medical Association, Angel?
That we had our physicians play an important role in the community. That's why we want you to have the best quality of service, the best quality of healthcare. So always ask what kind of doctor you are. If you're a physician, go through in the internet to see their credentials, so you can get the best quality of healthcare that you can ever get from our physicians.
Absolutely. And you have a tireless job as a
Yes.
managing director.
Yes, yes. So we have to be there for everyone, for our physicians, for our volunteers. We do appreciate all the time that our volunteers, and because we have to point out this, that they are volunteer, they're not receiving any compensation for the time that they're giving us into the association. So that's why we take care of them, and we are very grateful to have them with us as part of the team.
And what about you, Dr. Fernandez? What do you see, and what is your hope that our audience and doctors receive from this interview?
Well, the first one is for every physician in Dade County to be a member of the DCMA. As I said,
How many physicians are there?
In Dade, over 8,000.
So we're looking for 7,000
additional members.
additional members open for membership to get involved, to really educate themselves and for their community.
And educate patients also,
Correct.
because the physicians also have the role and to educate their patients. Say, hey, once you have the experience of being treated by the physicians, continue on that track.
And it's also important that it's open to all physicians, starting from the medical student all the way to, and I don't want to exclude the retirees.
No.
If you're retired, we need your education. We need your experience. We need your body. We need your help. So just because you're retired, many of the physicians are in active practice, as we talked about, are very complex, time-consuming, and we have very little free time. However, as once you start winding down, your experience is invaluable. So please, my goal is for every physician in Dade County to be a member of the DCMA, therefore providing tremendous insight to the issues that we are all facing today. In addition to that, educating the public. And ask your physician, hey, are you a member of the DCMA? Why not? Join. They can help. They can help you, and they can help me. Then you can help me. So I think that those are the primary messages I want. Everyone to be a member. It's not pie in the sky, 100%, but hey, shoot for the stars. Why not? Be the best you can.
Absolutely, got to aim for something. Otherwise, you're going to miss it. Miss it 100% of the time. Correct.
Exactly.
So if you want to get involved, it's miamimed.com, or they can call at 305-324-8717. I want to thank you both, and may you continue to have good success in your practice, in your life, and enjoy chocolate ice cream, Coco, okay? And Angel, thank you so much for being just that, an angel for our community and bringing us all together today.
Thank you for having us.
Thank you for
I
having
wish
us.
the community as well as yourself a happy Hanukkah and a Merry Christmas and a prosperous and healthy New Year to
Hallelujah.
all of you.
Absolutely. Hallelujah, right? And thank you so much for being here
Okay.
today with us. And I want to thank you for being and tuning in today to this wonderful, wonderful conversation about health and wellness, and wishing you all a happy, merry, lighting 2023 coming up. And I appreciate you being here with me today. I'm Fara Sax, and this has been The Community Voice.
Thank you.